Okay, I'm sure all of you guys have heard, cover your hands when you're coughing, cover your mouth when you're coughing. Sorry about that. You don't want to get anyone sick. Well, today I'll be talking to you about how HIV can truly be transmitted. There's been many rumors that have been going around that it can be through even just a handshake. I've been gathering research for this topic for several weeks, and it's true fact. I'm sure all of you guys have had a cold once and a fever. This is something that's new to our body, that isn't new to our body, but have you guys ever wondered, what if I have something worse? Well, today I will explain to you how HIV can really be transmitted and how this harmful disease affects these people with this disease. The first thing I would like to talk to you guys about is the true facts. Well, HIV, a human immune deficiency virus, is more frequently transmitted through unprotected sex or sharing contaminated needles, transmission from mother to fetus, or through blood products that significantly decline in the U.S. I'm going to go ahead and show you guys how. But sexually transmitted of HIV has been described from men to men, men to women, women to women through vaginal, anal, or oral sex. The best way to avoid sexual transmission is abstinence from sex until it is certain that both partners in a monogamous relationship are not HIV infected. Blood contains the highest concentration of the virus, followed by semen, followed by vaginal fluids, followed by breast milk. Centers for Disease Control and Prevention are basically what they show you, that the most common is usually unprotected sex. Transmission through infected mother through the fetus is a rate that is lowering, and some of the facts have been changed throughout the years about it, and a lot of people think that HIV is transmitted through other things. And no, HIV is not transmitted from day-to-day contacts in the home, the workplace, schools, or social settings. HIV is not transmitted through shaking, hugging, or casual kissing. You cannot become infected from a toilet seat, a drinking fountain, a doorknob, dishes, drinking glasses, food, or pets. HIV is a fragile virus that does not live along outside the body, and it is not airborne. And this is something that a lot of people think you can get transmissions through, and it actually makes just the lives worse of the people that are infected, because it goes day through day with people not wanting to shake their hands, not being around them, not wanting them to cough around them, thinking that if you use something they have, that they will get it, and it's just us singling out someone that just has something worse for them in their lives. Many people are not aware of how HIV affects the body of the person with it. I have a graph over the picture to show you guys. Okay. The earliest symptom of HIV infection occurs while your body begins to form antibodies to the virus, known as seroconversion, between 6 weeks and 3 months after infection with the HIV virus. HIV usually, it takes 2 to 4 weeks post-exposure. Most individuals, 80 to 90%, develop an influenza or mononucleosis. It's a like illness called acute HIV infection. This also shows the acute HIV infection for their head. They get fever. They also get weight loss for their body, and then they get skin rashes, liver and spleen enlargement. The Medical Review Board says some of the most serious symptoms of HIV involve the respiratory system. Symptoms associated with breathing and respiration usually occurs later in the course of the disease. Unfortunately, many people, that is their first symptom for HIV, and it involves the respiratory system. HIV, people, they get most of that in the beginning, the respiratory system, and it hits them hard, and they end up like going to the hospital sooner than they imagined, because that is one of the biggest symptoms for them to get. Over the years, the number of people infected with HIV at first came out increasingly high, and it slowly decreased, but in 2008, the numbers became slightly smaller than 2007. The cumulative total was 1,600. Males, it was 1,197, and females were 403. So they have increasingly been changing throughout the years. The males are the orange, and the females are the yellow. So this is the facts about HIV and how it can really be transmitted. And I'm pretty sure now that you guys have more facts. If you guys ever do know something with this, you guys know that it cannot be transmitted through airborne, and that it is something that is serious, but at the same time, you know what procedures you can take to not go ahead and get this transmission. Thank you.
Ricardo, what did you think? And you don't have to stand up there while that's going on.
The intro was good. I liked the preview. She said that she was going to try to explain some of the myths about HIV and how they're transmitted. Like that she tells how HIV is really transmitted, not through shaking somebody's hand or if they cough on you or something like that. Also like the example of how she said that people first notice that they have respiratory problems and then they go have it checked out, and that's how they find out they have the virus. And that's it.
All right. Thank you. Yeah, I thought that the coughing thing was okay. I'm not sure how big an issue that continues to be. I think you could have used a little bit more information about people subscribing to myths about HIV transmission. Once upon a time, that seemed to be kind of typical. I'm not sure it's as true today as it once was. And if it is, then I think you need to provide us a little information that shows that that's true. The topic's pretty clear. I think your thesis basically sounds like it's two parts to a speech. Your thesis sounds like a preview more than a general thesis about what all of the information is going to entail. We know what the subject matter is, and we're getting a layout of the structure, but what's the end point that we're looking at? I didn't think that was as clear as it needed to be. On the earlier parts of the speech, there's some data, and you're giving us some source citations on that. And that was fine. There's a lot of descriptive information in the presentation. I think you could generate a little bit more interest with some examples. It's organized adequately, but once you get into the points, or like I said, you had the two main points. Once you get into that second point, for instance, I didn't think there was a very clear way in which the symptoms that you're talking about are being discussed. It just seems sort of random and hit and miss, and I think you need to have a little bit more planned structure on that particular point. So you got the main points organized, but you don't have the supporting information as well organized. The visual materials were fine, although I think you might want to consider, especially with the first two, which are, the first one's very small and the second one has very light printing and imagery on it. You might want to think about turning off the lights to get a little bit more contrast and make it easier for people to see. The bar graph was actually fairly easy to see. It could have been a little bit bigger, but those are minor quibbles on that. The information on the bar graph, by the way, I thought was the clearest visual data in the presentation. Your delivery, I think you need a little bit more practice. Sometimes the pronunciation is a little bit awkward. Sometimes it just doesn't go quite as smoothly as it could. But there weren't any big problems that you should be worrying about, just technical things to fix along the way. All right, thank you.